Hi, my name is Lauren, and I'm going to be your student nurse today. How are you?
Good.
Good. I'll be doing an assessment. It's going to take about 15 minutes. Do you have any questions?
No.
Okay. I have a few questions for you. Can you tell me your name?
David.
Okay. And where are we today, David?
The nursing home.
Okay. And do you know what day of the week it is?
Wednesday.
Very good. Are you experiencing any pain? What about difficulty breathing?
No.
All right. By asking the client these questions, we can tell that he's alert and oriented ×3. Also, he's not experiencing any difficulty breathing or any pain.
All right, David, next we're going to assess your eyes, so I'm going to have to shine a bright light in your pupils in just a moment, okay? First, we're going to check and see what size they are. I say about they're 4 millimeters, equal on both sides, and that's appropriate for the light in this room. Okay, I'm going to shine this light in your eyes once each time. All right, your pupils were equal, round, and reactive to the light. They constricted from a 4 to a 2, and that's appropriate for the amount of light in this room.
Okay, at this point during the assessment, we're ready to go ahead and listen to the posterior lung sounds. David, I'm going to be listening in a few different spots on your back. I'm listening to a lot of spots, but it's no need to worry, okay? I just want to get a good sound. Each time I move my stethoscope, just take a slightly deeper than normal breath through your mouth, okay? If you feel lightheaded or dizzy, please let me know. All right. You want to make sure the diaphragm of your stethoscope is on and that the earpieces of your are pointing towards your nose. Okay. All right, David, your lungs sound really nice and healthy. Posterior lung sounds were clear throughout and symmetric bilaterally, and no adventitious sounds were noted. All right, David, now I'm going to be listening to the anterior side of your lungs. Again, I just need you to take a slightly deeper than normal breath. If you feel lightheaded, let me know. Okay. When you find spot 1, you want to make sure that your stethoscope is nice and flat above the clavicle, okay? And deep breath. The anterior lung sounds are clear throughout, symmetric bilaterally, and there were no adventitious sounds noted.
Okay, David, now we're going to go ahead and listen to your heart sounds so you can breathe normally for this part. All right, first I'm going to point them out. You're going to find the suprasternal notch, go down to the angle of Louis, over to the right, second intercostal space, and this is the aortic. You're going to come over to the left, second intercostal space, and this is the pulmonic. Down to the next intercostal space is Erb's point. To the left lower sternal border is tricuspid, and over to the midclavicular line is the mitral. Now I'm going to go ahead and listen with the diaphragm side of my stethoscope to a few beats in each side. And again, you can breathe normally for this. Now I'm going to flip my stethoscope over and listen up with the bell side. Okay, your heart sounds good. S1 and S2 were heard throughout. They were neither accentuated nor diminished. The rhythm was regular, and I didn't hear any extra sounds.
For this part of the assessment, you want to make sure your client is relaxed on their back with the knees bent and the feet flat on the table. This will help to relax the abdominal muscles. David, are you experiencing any pain in your abdomen today?
No.
Okay. When you're inspecting the abdomen, you want to look at the shape. Your abdomen is flat, symmetric bilaterally. Also, there's a little bit of central hair distribution around the umbilicus, which is inverted and is midline. Also, on the abdomen, David has nice pink, warm, and dry skin. All right. At this point, we can go ahead and listen with our stethoscope. Starting in the right lower quadrant, listening with the diaphragm. And we're going to listen until you hear bowel sounds. David, your bowel sounds were present and active in all 4 quadrants. At this point, you can go ahead and palpate the stomach. You want to make sure that you're using a nice soft touch. You're only going to go about 1 centimeter deep, and you can just overlay your hands like this. You're just going to make sure you press on all 4 quadrants, slightly overlapping. Okay. David, your abdomen is soft but not tender. Also, the muscle wall is firm but not rigid. That's exactly what we want to see.
While your patient's still laying down, you can go ahead and check their peripheral pulses, so we're going to start with his wrist. His radial pulses were symmetric with a +2 strength. The rhythm was regular and they were smooth and elastic. Now we can go ahead and check his dorsal pedis pulses. His dorsal pedis pulses were also symmetric with a +2 strength, regular rhythm, and smooth and elastic. Okay, David, now we're going to go ahead and check for Hohmann sign. So I'm just going to lift your leg up here, and we're going to flex your foot towards your head. Do you feel any pain in your calf?
No.
All right, you can go ahead and set this one down. Now we're going to do the same thing with the other one, grabbing underneath the knee and flexing his toes towards his head. Any pain in this one?
No.
All right, the lack of pain indicates that the Hohmann sign was negative.
And now we can begin the last part of our assessment. David, are you experiencing any numbness or tingling in your arms or legs? Okay. I'm going to go ahead and test the strength in your legs. If you could for me, I'm going to put resistance on your legs. Lift your leg up against it. Don't let me press your leg down. Very good. You can rest now. We'll do the other leg. Resistance. Well done. You can relax now. The strength in David's legs was a 5 out of 5, and it was also symmetric bilaterally. I'm going to go ahead and have you sit up. All right, now we're going to test the strength in your arms. You can grip my fingers and resist my pull, okay? Very good. The strength in David's arms was a 5 out of 5 and was also symmetric bilaterally. The last part of our assessment, David, I'm just going to touch you in 6 places on your body with this piece of cotton. Each time it touches your skin, I just want you to say the word now, okay? And you want to make sure you have your client close their eyes for this part of the assessment.
No. 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 No.
Very good. You can open your eyes. David's light touch sensation was intact and symmetric bilaterally.
We hope this will be a great study tool for you guys with our final competency. We've almost made it through our first semester of nursing school.
Thank you, David, for being such a great participant.
You're welcome. You owe me Chipotle.
We'll get right on that.
Thanks, guys.